Joshua Sam. Mike Shambaugh. Mobina Shot Pouch. E.O. Smith. Condessa Teehee. We have a quorum.
Thank you, Shelley. Okay, on to reports. So, well, let's see. Maybe we need to approve the minutes. I would entertain a motion to approve the minutes.
Second.
All those in favor? Any opposed? Motion passes. On to reports. Mr. Deckard is going to come and fill us in about the Claremore Service Unit.
Good afternoon, ladies and gentlemen. Thank you guys for having me again. As always, you should have a copy of the report, Claremore's report, in your folder. It's updated with the most recent data and all the updates from the previous month. I did have one thing that I wanted to add, something somewhat near and dear to my heart, and it's veterans. So last Friday, Claremore Indian Hospital collaborated with the Department of Veteran Affairs to host our third annual PACT Act event. So if you don't, the PACT Act has become more and more familiar over the past few years since this act's been passed. You hear it on the radio and things of that nature now, but if you're not familiar with it, it's a law that expands VA health care and benefits for veterans exposed to burn pits and other toxic substances. It's a significant expansion to these benefits, particularly for veterans of the Gulf War and post 9/11 era, to include provisions for Agent Orange exposure for Vietnam vets as well. So during these events, veterans are able to speak face-to-face with VA representatives, get support in filing for VA disability claims, things of that nature. And that can be a daunting task and something that a lot of people just, they give up on or walk away from. So these events are really big in getting veteran support and filing for these disability claims. And also, while they're able to receive a toxic health screen, which is important, especially for folks that have been outside of the United States and in service and active war zones and things of that nature. So I don't have all the data yet because it is new, but I wish I would have got this out last month to kind of promote it and let everybody know. We do everything we can to get as many folks as we can do this. And ultimately what we're wanting to do, we want to help everybody that has, and I say we, this initiative, this is our third year to do it. We want to help anybody through the process and the disability claims and things of that nature, but we really are driving to get people in that have never filed for a claim. And those are the big ones, right? People that have not taken advantage of their benefit, if you will. And so we had 11 veterans that applied that had never, or that came in for assistance that had never sought or filed a claim before. So at Cherokee Nation Public Health Nursing, they were there as well to support the event. We get a lot of community folks, the DAV, the VFW, the list goes on, the people that come to this. So anyway, for your constituents, whenever you meet someone that's a veteran, and this is something to maybe bring up and have discussion with them, make sure they're taking advantage of that opportunity. So anyway, that's all I have. Anybody have any questions?
Danny?
Yes, sir. Glad to have you with us today. I was wondering, looking through your report, the third-party revenue is down quite a bit from what it has been the last 3 years. Is that your fiscal year over October 1st? Is that the beginning of your new
Correct.
fiscal year? So you still have 2 more months to. I just wondered if maybe you guys were seeing more people without, that didn't have any way to do the third party, or what the deal would be.
No, and I don't recall for the month of May. I'll have to look at it. I do know that we've, we're looking at the way that we've progressed. We're looking at hitting and or exceeding last year revenue and our goal. I think it's like 59 million. So fingers crossed. But if you were to look at each month, what have we done? 7 through May, 7-8 months. We're looking to accomplish our goals. So But I'll look and see. I don't recall from the month of May why it was down.
Anyone else? Tony, I know our end product will not have an inpatient component to it. Right now, you do have inpatient, right?
Sir.
On average, the reports we get, you average about 4 patients a day. Is that kind of the ballpark where?
For inpatient?
Yeah.
It varies. I mean, but that would probably be appropriate. Yeah.
How many beds do you have?
There is, I think it's 32 now. It's 26 to 32. It fluctuates. It's fluctuated, since COVID. We changed it a lot then because we had to convert rooms, that were, 2-patient rooms to 1 and so on and so forth. But I can't remember if it's 26 to 32.
So it's a little unpredictable as far as how many patients you have. So how do you staff the inpatient? How do you staff them in terms of numbers? Do you have a half a dozen inpatient employees show up for each session?
Yeah. See, we're able to utilize the staff, and don't get me wrong, I'm going to go real light here on this response because I'm not dove in or don't dive into staffing needs for nursing. That's what our chief nurse executive manages. We do have discussion at leadership and approve, positions and things of that nature. But I do know that, we're staffed, for like our ICU. It's fairly light. And we utilize staff within ICU to support GMS, or they can support other areas throughout the hospital. So we've staffed it based on our inpatient averages.
Anything else for Tony? All right, thank you for your report, Tony.
Thank you, guys.
Dr. Stephen Jones.
Good afternoon. I know you have your report in your packets, and I'll just highlight a couple of things in that report, and then have a couple other highlights to hit for you, and then we'll answer some questions. But hopefully you like I think I've said this a few times, but the format for the report now has the number of contract health referrals. I know that tends to be what I get the most questions from this body on, and so it kind of shows you how many we are processing each month, and you can see a 3-month trend on that. So hopefully that's been helpful to see the numbers that we're processing, that our staff processes. Prescriptions filled, we're still averaging over 200,000 a month, and that's an average, so keep in mind that you can see our pharmacies are very, very busy. All vacancies within health professionals, that number, we've gotten it down a little further, down to 3.7%, and that includes all disciplines and nursing in that number. So our recruitment department continues to work very hard to get those vacancies filled and keep them filled. This time of year is kind of that turnover time. We're seeing residents leave us, we're seeing new residents come in, we're seeing opportunities for employment. A lot of graduate schools are graduating their students. If they haven't found a place to go, we usually start recruiting in February. So you're going to see a little bit of changeover right now. People are finishing their scholarships and moving on, or they're bringing on new scholarship recipients. So there's a fair amount of turnover through the summer. We usually see this every year. The other two things that as we increase our number of patients we see each month, the other two departments that are really heavily impacted, as well as pharmacy, not that all of our departments aren't impacted, but heavily impacted, is radiology and lab. And you can see that the lab numbers this month that we're reporting on, which was May, the lab tests that we ran in lab services were 123,000 lab tests that month. So it's a lot. It's a lot for our lab and our radiology department to continue to do all those diagnostic testing. On construction, you know that we're getting very close on Salina. We're doing punch lists now, and you're seeing a lot of, if you've been up there to see it, it's beautiful. And I know that I have several teams there today doing equipment and doing some training and doing some installations. So we're getting very close on Salina. Looking forward to getting that facility open. I know the staff is. They're very excited and looking forward to having some new facilities to work out of. It's been a long time coming for that community. The hospital is on schedule. We're starting to see some, if you walk through it, which I hope that you will get a chance to do soon, we'll probably have the orientation for new counselors and for counselors that are still seated or still sitting coming up after the swearing-in ceremony. We'll get that scheduled, and hopefully you'll come and do a walkthrough. We'll have that as part of our orientation to walk through one floor of the hospital. It's getting very exciting to see some of the things that are done. Paint's on the walls on the 6th floor now, and we have some head walls installed and the flooring's installed, and it's starting to have a reality to it. It's not just bare bones. So they're working from the top down, and they're starting on the 4th floor now. So 6th floor is very close. 5th floor is a little further along than the 4th, and the 4th is starting to put down some of the components that make it look like a place. So hopefully you'll get a chance to do that, and encourage you to do that if you get an opportunity. Claremore, I know we have a lot of questions, and probably will have some questions on Claremore. We're at the point of, we've closed the applications process week before last. That closed for all existing Claremore employees to apply for jobs. And then those applications were evaluated and put on panels for the hiring managers. The hiring managers had last week to interview, to evaluate those panels, to make their selections. Those selections have been turned back into HR. HR is working on compensation so that they can make offers based on resumes, based on time, that experience, and things of that nature. And we look forward to this week, probably middle of this week to the end of this week, to seeing those offers being given to the employees there, or in groups. It won't all be a one time. It'll be different departments will meet and start making those offers. The professional offers will be done on contract, just like all of our professionals are on contract. And we hope to have those out in the next week to 2 weeks also. So that's kind of where we're at with Claremore as far as the transition goes. You know, we had Chief sign a funding agreement I believe it was the week before last. We finally got to the place where we could all agree on the things we could. There were some things that we couldn't agree on, and Chief signed that funding agreement and sent it to IHS. I believe there's a date when IHS has so many days to respond and sign it. So that day is coming soon, and that'll be a big accomplishment, just having a new funding agreement put in place. It's been several years since that was looked at, and it was a long negotiation that started back in the end of November, and we met every week up through May. So it was a long process, but we are here, and we're glad, and we're happy with the agreement on 90% of it. Like I said, there was a couple of things that we couldn't come to terms on, and we chose to set those aside and agree to disagree on those things. So we were at an impasse. I believe that's the correct term. So with that, I'll close it up and close my comments and answer any questions.
Dora?
Can you speak to approximately how many applications were submitted?
Yes, I don't have the exact numbers, but I do have some numbers. There was approximately around 350 jobs that are going to be available, and we had 285 unique individuals that applied. They may have applied for several positions, so the number of applications is going to be it. But the unique individuals that applied for positions was 285.
Okay, thank you. Thank you, Chair.
Sasha?
Thank you, Chair. With those applications, priority, again, was offered for those existing Claremore employees.
It has not been opened up to even contractors. So Claremore has a lot of people that are employed there that are on contract from Chenega. Is that the name of the company? Chenega has provided them with some locums and things of that nature, and we will open up the second round to those contractors. But this was exclusively for those full-time employees that are there that were not on contract.
Okay. What about native preference?
This first round, we are giving preference to the employees that are there. So if an employee is there and they've been there and they have preference over anybody outside or any contract employees.
Okay, thank you. Thank you, Chair.
Mike?
Hey, Dr. Jones, did you ever get a chance to get a work group together about possibly expanding our dialysis centers for our citizens?
Yes, Chief signed an order for us to do that back several months ago, and that work group has been working. We've actually had 3 work groups. One's on telemedicine, one's on dialysis, and one's on subscription to Medicare. And those have been meeting weekly and biweekly, and in the last 6 weeks, 4 weeks, they've been meeting with me, Chief of Staff, and Mr. Duncan to give their findings and refine the report. And I think Chief extended that deadline to August 30th for that report to be submitted to him.
Okay, thanks, sir.
Yep.
I see no others. Thank you for your report, Dr. Jones.
All right, you're welcome.
Now for public health, not Lisa, but certainly have a expert.
I'm sorry. Okay. Good afternoon. We'll start again. Lisa's on travel and sends her regards. She's not here. Just a couple things to highlight, because I know you have your report in your packet. The weather has actually cooperated, so we were able to do some Wings in-person events recently. And the ones in May, there was over 2,500 participants, both virtually and in person, so that's great for those events. Seniors Farmers Market is in full swing. We opened those applications in May. And over the last couple months, we have about 2,000 cards that have been issued for our Seniors Farmers Market. And to that, we've added actually 50 additional growers this year, farmers that can participate to have more access to fruits and vegetables. And we had our World Tobacco Day, or World No Tobacco Day at different locations throughout the reservation, and we had about 400 participants with those events and had quick kits and information about smoking cessation, so very successful. That's all I have.
Do we have any questions? I see none. Thank you for your report.
Thank you, everyone.
Appreciate it. Okay. Old business, none pending. New business, none pending. Announcements, the next meeting is scheduled for Monday, August 11th at 1 o'clock. I have one health-related announcement. On Tuesday, July 29th at 10 o'clock will be the ribbon cutting for the new optometry school. That's Tuesday, July 29th at 10 o'clock. I assume it's at the new school. That's going to be quite a difference compared to where they've been. I'll date myself. I actually did an internship in the old Hastings in '77, and it hadn't changed much. But this new building, it'll certainly be a big change for our students and then our patients as well. Okay, any other announcements? Need one more motion. All those in favor? Okay, we're adjourned.